Good morning. My name is Dr. Mohan Suntha, and I am privileged to serve as the President and CEO of the University of Maryland Medical System. On behalf of our entire health system, I want to welcome you to today's program, Finding Hope, on Dr. Martin Luther King Jr.'s Day of Recognition for the life and legacy of Dr. King. I'm honored that you've all taken time today to be part of this critical conversation, and we could think of no better way to recognize the legacy of Dr. King than to engage in purposeful conversation with members of our community about the advancements that have come forward with the COVID-19 vaccine and the questions that remain in our communities. But first, I want to introduce the moderator of today's session, Dr. Freeman Hrabowski. Since 1992, Dr. Hrabowski has served as the president of the University of Maryland, Baltimore County. He is an unabashed ambassador for our students, for our communities, and he is an international thought leader in the world of higher education. Amongst his many accomplishments include the creation of the UMBC Meyerhoff Scholars Program, which started back in 1988. This program specifically is designed to promote the achievements of minorities in the field of science, technology, engineering, and mathematics. As again, he is a passionate advocate. We were ecstatic that he agreed to today to serve as our moderator. Dr. Hrabowski, welcome, and thank you for leading us in today's important discussion.
Thank you, Dr. Suntha. I'm delighted to be here. I'm Freeman Hrabowski, and it's a special day. As all of you know, this is Martin Luther King Day, a time for inspiration and for hope. A time, though, at the same time that we find ourselves in such a major pandemic with over 23 million people who've been infected by COVID-19 and almost 400,000 Americans who have died. We have watched this disease have such an impact on our lives, on the economy, and it has been a struggle. But Dr. King told us to remember to keep the hope alive. And that's the message today. As we go through this, as we think about his legacy, the question is, how do we look at COVID-19, the greatest challenge we face in humankind in so many ways, as providing light to us as we think about the vaccination itself? This is a time for a moment of hope. And so let's remember what Dr. King said to all of us, that whatever affects one of us directly affects all of us indirectly. And speaking of the COVID-19 vaccine, Dr. Suntha, have you gotten vaccinated yet?
Yes, sir, I have. And when I thought about the decision to be vaccinated, I believe that ultimately as a physician, science helped inform my decision. Understanding the science behind it, and you will hear more about that from our panelists. But for me, it ultimately also included a very personal decision. As a father, as a husband, as a brother, and as a son of elderly parents, and as a physician, I felt the single most important thing that I could do for my family and for my community is, in fact, to understand the science and make the informed decision to get vaccinated. And I know all of our panelists today will share with you their own personal experiences about their decision-making process. But as we've engaged in conversations with our communities, a recurring question that comes up is this conversation that centers around the idea of representation. And one concern in our communities of color are the realities that historically we haven't always been represented. We didn't have a seat at the table as these ideas came forward, as science evolved. And I was wondering if you could speak to that issue, specifically around the COVID-19 vaccine creation and the science behind it, because I think that could help inform our communities.
Thank you, Dr. Suntha. That's an excellent point. Representation is critical. Many of you may not know that this COVID vaccine was actually developed at the National Institutes of Health, NIH, through their research and led by two scientists, Dr. Bunny Graham and Dr. Kizzmekia Corbett. Well, all of you who know me know that I'm so proud that Dr. Kizzmekia Corbett is a UMBC alumna. She was a member of the Mouth of Scholars program, came to us from Hillsborough, North Carolina, as a 17-year-old, and graduated and went on and majored in biology and sociology, went back to her home state, Chapel Hill, and earned her PhD, came back to do a postdoc at NIH and has been there ever since. And she led this team. And so as she has been working on this, she's been texting with me about it. And one of the points she mentioned was that they were so excited about the vaccine, but were having a really hard time convincing people of color, and particularly African Americans, to get involved. And that's why Jackie and I, my wife and I, decided to be a part of this process. And I will tell you that working with the Center for Vaccine Development there at University of Maryland School of Medicine has been an inspiring experience for us, because we saw people of all races there as healthcare workers. The people cared about us. And this weekend, we had the experience of going through what's called the unblinding visit, which meant we could determine whether or not we got the placebo or whether we got the real deal. In other words, half the people got the real vaccine, the others did not get it, so they can see what the difference is. And we were very, very fortunate to have gotten the vaccine. And so as we go through today, I want all of us to think about the significance of this vaccine and the idea of the hope it brings to all. Dr. Santa.
Thanks, Dr. Hrabowski. You know, you bring up a really important point that I'm hoping you could elaborate on, and that is in both the Pfizer and the Moderna trial, one of the exciting bits of data that we have from these studies is in fact the diversity of the populations that were studied. I wonder if you could speak a bit about that in terms of the representation that were actually in the study, such as yourself. Participants such as yourself?
Yeah, I think it's an excellent question. It's one we are asked a lot. Let me give you some of these details. For Pfizer, there were more than 37,000 participants. 9% were Black or African American, 28% were Latino, and 21% had at least one underlying health condition. For Moderna, of the 30,000 participants, 20% were Latino, 10% were Black and African American, and 25% were 65 and older. And when we talk about this underlying health condition, it could be diabetes, it could be obesity. For me, it was high blood pressure, for example. And so the fact is that these groups of the sample for both of them, for both of these vaccinations, have everything to do with people from all the different racial and ethnic groups and people of different ages. And we know, and what we have found that's most important is there was no difference in the effectiveness of the vaccines for the different populations, different demographics.
Thank you, Dr. Hrabowski. And so now I'd love to have the opportunity to introduce our distinguished panel, and they will collectively work to answer the questions that we've heard from our communities as we've engaged in purposeful conversation. Joining us today includes my friend and colleague, Dr. David Marcosi. Dr. Marcosi is a professor in emergency medicine, and he is also the COVID-19 incident commander for both the University of Maryland Medical System and our partner, the University of Maryland, Baltimore. He also serves as a senior medical advisor to the governor in our state's COVID-19 response. In addition to Dr. Marcosi, we have Dr. Michelle Gourdine. Dr. Gourdine is the interim chief medical officer of the University of Maryland Medical System. She is also senior vice president for our population health and primary care efforts. She is the former deputy secretary of health in the state of Maryland, and also a former health officer for Baltimore County. Joining Dr. Gourdine is Dr. Stacey Garrett Ray. She is the president of the University of Maryland Quality Care Network and Transform Health MD, and she is the vice president and medical director of the Medical Systems Population Health Service Organization. Joining Dr. Garrett Ray is Dr. Joseph Wright. Dr. Wright is Senior Vice President and Chief Medical Officer at the University of Maryland Capital Region Health System in Prince George's County. He is a professor of pediatrics and health policy and management at both the University of Maryland School of Medicine and the University of Maryland School of Public Health. And joining Dr. Wright is Dr. Fermín Barreto. Dr. Barreto is a senior physician, emergency medicine physician, and also serves as the senior vice president and chief medical officer of the University of Maryland Upper Chesapeake Health System in Hartford County. So we have a full schedule today. We have many questions, and we know we're going to encourage folks to listening to use the Q&A window in your chat box. And what we commit to you is that as questions come in, we know that we won't be able to answer every question, but we will work to later this week connect a web page that will have answers to all of the questions that come forward during this session. So I'm now going to turn it over to you, Dr. Hrabowski, and let's jump in.
This is great. So the first question is for Dr. Garrett Ray. Dr. Garrett Ray, so many Black and Brown people have been disproportionately impacted by COVID-19. Can you explain why that is the case?
Yes, Dr. Hrabowski, that's an excellent question. First, I just want to talk about the unequal impact that we're seeing within the community. Within the Black and African American communities, we are 1.5 times, 1.5 times more likely to get COVID. And from those of us who are impacted by COVID-19, we're nearly 4 times more likely to be hospitalized and 3 times more likely to die. And as you had mentioned before, there are some chronic conditions, there are some health issues that actually increase our risk, including heart disease, lung disease, diabetes, high blood pressure, as well as obesity that actually increase our risk as well as the complications and death due to COVID. Another thing that we are also seeing is that having a low vitamin D count, low vitamin D levels, and that has to deal with what we're taking in with our diet, as well as some of it comes from sunlight too. So I'd really encourage all of us to think about how can we stay healthy during this time? How can we engage with our primary care providers to make sure that those health conditions are under control? The other thing is that we are really seeing that there are some other things that impact why we are seeing these changes and the differences and the social inequities and that are putting our communities of color at higher risk. And that really does include having access to the healthcare, education, some of the occupations, as well as our income level and housing, which also increases some of the overcrowding that we're seeing that is out there. All of which are ways that actually increases our risk of having COVID-19 as well as death from COVID-19.
Thank you, Dr. Garrett Ray, very helpful. The Latino community also carries a disproportionate impact of the COVID-19 pandemic. Dr. Barreto, can you talk about that?
The Latino and Latina individuals, to echo some of the stats that Stacy was just talking about, we're twice as likely to get COVID-19, 4 more times likely to be hospitalized, and 3 times more likely to die. Many of the chronic health conditions and socioeconomic factors we share with the Black and African American community. And you combine that with the health inequities that exist, and we're really making a bad situation worse. Then you add in the very real language barrier. And there was actually a New England Journal of Medicine article just published January 7th, published with by our Johns Hopkins colleagues who actually articulated a lot of these challenges, trying to transfer patients to our Baltimore Convention Center that takes care of COVID positive patients. Many had refused because they were concerned that it was a detention center. Also, we have the challenges with undocumented immigrants and fear of the healthcare system. To them, I tell them, cuando es tu turno para tomar la vacuna, no tienes miedo, por favor, tómalo, which means thank you. When it is your turn for taking the vaccine, please take it. Do not be afraid.
Thank you very much, Dr. Barreto. And could you say something about the fear of coming into the healthcare system for undocumented individuals?
That fear, of course, is fear of deportation, fear of once you interact with the system, that you will be essentially taken away from family and from where you may live. So that fear, of course, with any anti-immigrant policies or culture out there can make things difficult. They will stay at home and risk further illness with COVID versus interacting with our healthcare system and trying to get help.
But they can get the vaccine when they come in.
Absolutely,
It's very
100%.
important.
They will be able to get the vaccine. They should not be afraid.
Very good. Dr. Wright, what other obstacles can we talk about that have to be overcome as we want to make sure that we're reaching these communities that are so heavily impacted by COVID-19?
Thank you. That's a great question. Part of our communication effort that is so important is reaching people where they are, especially during COVID-19 when in-person conversations are harder. Town halls like this are a great way to reach the community. However, not everyone has regular access to the internet, email, or even phone. So we have to be creative in how we're getting the message out to people and making sure we are addressing concerns on the ground in their communities. So what does this look like? This means face-to-face, peer-to-peer, personal and private communications with trusted voices in our communities to listen and authentically understand folks' concerns. In addition to the language barrier that Dr. Barreto referenced, there is also the need to demonstrate cultural humility in respecting folks' personal journeys and how these experiences may be influential in decision-making around the vaccine. So navigating historically embedded and perpetuated structural inequities and outright discrimination are factors that are also very real. These realities can coalesce and certainly impact access and can even affect the quality of care that people receive in certain healthcare settings. So a number of factors, Dr. Hrabowski, that we need to be concerned about.
Excellent points, Dr. Wright. I'm going to Dr. Godin now, and I'm going to say something that she doesn't know I'm going to say, but I want to say this just to give us a moment of personal story. The fact is that she and I both come from the Deep South. She is from Mississippi. I am from Alabama. If anybody knows about structural racism, Black people in the Deep South, we're around the country, of course, but we do. And I say that because, Dr. Godin, here's my question to you. How do we deal with the historical challenges that Black and brown people have had to deal with the healthcare system, from the Tuskegee experiments to Henrietta Lacks? Why should we get this vaccine? It's what Black people and brown people are saying. And are the vaccines being tested on these people?
Dr. Hrabowski, those are very essential questions, and you are absolutely right. There is a lot of deep hurt and mistrust among Black and brown communities, and that hesitancy and mistrust is grounded in history, as we just talked about. You mentioned the issues with Tuskegee, Henrietta Lacks. There are many others that are relevant as well. But the bottom line is that we have a history in this country of performing harmful research on communities of color, of exposing them to unnecessary risks, of not fully explaining the research that we're doing, and in treating them as an experiment without their consent. And so people have, been deeply impacted by this history that we certainly must confront as we move forward with this vaccine. But here's the good news. A lot of work has been done since that time in acknowledging the errors of the past and making sure that the healthcare provider is seen as a trusted messenger, focusing on our ability to communicate with our patients with transparency and patience, being willing to respond to and answer their questions, as evidenced by what we're doing today. And so what I want people to take away, and it really does echo many of the comments that have already been made on this town hall, is that the COVID vaccines were studied across very diverse populations. Individuals who bravely volunteered to participate, like yourself and Jackie. Thank you very much to both of you for doing that, because that's important, not only in terms of your participation, but in terms of being a role model to the community and demonstrating your trust in the science. Bottom line, we believe in the science behind this vaccine. It is the best tool that we have to stop this pandemic and protect all communities, including Black and brown communities.
You well said, Dr. Godin, as a fellow Southerner. And by the way, the fact is that this town hall meeting, Dr. Cynthia, I want you to appreciate this, is the fact that if Dr. King were here today and he looked on this screen and he saw the diversity of people, he would be saying, we are certainly making progress. And I don't want this to be lost on anyone. My next question is to you, Dr. Wright. Again, because we've been in this study, our friends, Black and Latino, constantly are asking the question to us, well, then what does this mean about the vaccine right now? Why are Blacks and Browns not being vaccinated first? It's a question people ask. And so, Dr. Wright, give us an answer. Tell us what you think.
So another very important question, and a complex one, especially given the historical inequities that we've just been talking about. There are many perceptual sensitivities around the optics of asking Black and Brown communities to be vaccinated first. In fact, I've heard directly across the community in response to some of the media coverage of frontline workers of color being vaccinated. See, Dr. Wright, they're putting us out front to see what happens. This speaks again to the historical realities that must be acknowledged that perpetuate the belief that this vaccine is being used to experiment on communities of color, or on anybody for that matter. Let me unequivocally dispel that concern. And in fact, let me refer back to Dr. Hrabowski, you and Dr. Suntha's opening remarks, in which you all spoke about representation and a seat at the table. In contradistinction to the Tuskegee experiment, where African-American men were denied treatment, here in the midst of a pandemic that is disproportionately impacting people of color, we have the tremendous opportunity to directly mitigate that disproportionate effect through participation.
Excellent, Dr. Ray.
And let me just add one more point,
Sure.
Dr. Hrabowski, that I would be remiss if I didn't mention. Here in the state of Maryland, where demographically, communities of color collectively represent the majority of the population of the state, we have the opportunity to make a tremendous difference. And we fully recognize this. So rest assured that planning is very much underway to get these vaccines out to our communities as quickly as possible.
Very good. Very good. Thank you. Let's talk about the vaccine itself. Dr. Marcosi, everyone wants to know what is in these vaccines and how do we know that they're safe?
Good morning, everyone, and thanks for your question, Dr. Hrabowski. First of all, I was pleased to be vaccinating individuals earlier this morning. It was a real honor. Answering questions like this are critical, and they actually came up this morning. There are only 4 things in this vaccine: mRNA, buffer, fat, or otherwise known as lipids, and sucrose, or sugar. I want to be very clear. You cannot get COVID-19 from these vaccines. The vaccines do not contain any part of the live virus. These vaccines do contain messenger RNA, or mRNA. They are new because this is the first time that we've had them available for use. But researchers have been working on this kind of vaccine for more than a decade. To be clear, they will never interact with your DNA in any way. So here's how these vaccines work. The COVID-19 vaccines contain a code, which is the mRNA, that tells our cells to make something called a spike protein that the COVID virus has. That causes our immune systems to react. In response, our bodies make antibodies. After that is done, our immune system knows how to protect itself and from future infections after being exposed to COVID-19. Once our body is done with that mRNA in the vaccine, our cells break it down, so it does not even stay in our bodies. We know the COVID-19 vaccines were developed quickly, but rest assured, the vaccines were not rushed from a scientific perspective. Some administrative steps were shortened or completed side by side, but no safety steps were skipped. The FDA has given these vaccines what is called emergency use authorization, or an EUA, which helps us get the treatments out quickly for vaccines during public health emergencies like this pandemic. In fact, FDAs have been used during other public health emergencies in the past. Thanks.
It's an excellent answer and very reassuring. And our goal today is to give people confidence in the science, in the expertise, and in the experts, you. And so as a follow-up, the question about side effects is something that people are concerned about, side effects of the vaccine. Can you talk a little about the side effects, and more important, how do these side effects compare to COVID-19 symptoms? Dr. Barreto.
Thank you. Absolutely. So just speaking to my own side effects, I had some arm pain. I was definitely one that had more of the mild effects. You can have anywhere between mild and moderate effects. Most of them are self-limiting and within 48 hours. You can have fever, headache, fatigue, chills. Compare that to COVID-19. First, as a clinician, all of us have seen this virus do things that no other infectious disease process has done. You have loss of taste and smell, severe respiratory distress or shortness of breath. I'm a clinician that takes care of post-discharge COVID patients, and I see them with ailments that really last for weeks, sometimes even months. So when you compare the COVID vaccine, which over 9 million people have now received across the United States, to the COVID virus, there is no comparison. We see what it has done to our healthcare system, and this COVID vaccine, of course, with its adverse effects being very rare, its side effects being mild to moderate, really makes the decision easy.
Thank you very much, Doctor. Let me say that when my wife and I took the vaccine in the study at that Center for Vaccine Development, I keep pushing that center because they are so good there. The fact is that we didn't know whether we had gotten the placebo or we got the real deal, but we knew that we could not want to exercise. We didn't exercise for a day or so, almost 2 days, only because we were feeling tired. We had some fatigue. And I keep saying, I felt a little loopy, just different. I knew something was different. Yeah. My wife kept saying, but you're always loopy, Freeman, so it doesn't matter. So we laughed about it a lot. But what we kept thinking as we had a little sore arm and we were tired is, maybe this means we got this vaccine. It's going to help us. So, I mean, getting a little fatigue and everything is a great thing. And I put that in as a personal comment. My next question is to Dr. Garrett Ray. Why are there multiple vaccines, and are there differences among those vaccines?
So Dr. Rabowski, it's really going to take us to multiple vaccines for us to be successful in this fight against COVID. So there are many people who need to get the vaccine. A lot of individuals, when you think about this, it's in our community, it's worldwide that we need this vaccine in those numbers. And it's going to take a collaborative effort, which requires multiple solutions, multiple vaccines for us to be able to do this. But when you ask the question about the differences, I first want to just make sure people are very clear about what is the similarity between these. And that is the effectiveness in protecting us. So 95% effective for these vaccines that we're seeing, giving us the same protection. So there are two different types that are out there. People hear about the Pfizer vaccine as well as they're hearing about the Moderna vaccine. There are things to think about with differences, and one is dealing with storage. So the Pfizer vaccine needs to be stored at an ultra cold temperature. So this isn't something that can go into our routine freezers that we have at home or at our offices. This is something that it requires a special environment, and that's minus 112 to minus 72 degrees Fahrenheit, which is extremely cold. While the Moderna can be actually stored in a regular freezer, which is the temperatures of minus 13 to minus 5 Fahrenheit. Now, the other thing to note about these two is the difference in terms of the dosing days in between your first and your second dose. So for the Pfizer vaccination, which that's the one that requires that we have 21 days in between, and the Moderna is 28 days in between those two dosages. So that's actually another difference that we see with that. For both of them, your first and your second dose, you need to have the two dosages in order to have that protection. So I want to make sure to stress that to everyone. So just getting the first dose isn't enough. We got to get you back in for that second dose. So that is something that is really, really important. And so when you get your vaccine, if you got a Pfizer vaccine, you're going to get Pfizer the second time. It's not that you're able to actually switch in between those. So just want to make sure people are very clear on that too. At this time, the vaccine you're given, again, it's really a matter of supply. So and some people may say, I want to have that choice. Well, at this point, it's about supply. We just want to make sure people are in. And most importantly, to know that it's effective. Both of them are equally effective for all demographics.
Thank you very much. Dr. Garrett Ray, what's interesting to me is that it was the second injection that we received when we felt the effect. It was for us, I mean, for my wife and me, it was that second one when we really got that feeling of fatigue. My next question is for you, Dr. Gordine, and it has to do with the fact that some people have already had COVID-19 and they want to know, well, why should I take the vaccine? So is someone who has already had COVID-19 somebody who should also take the vaccine? Dr. Gordine.
Dr. Hrabowski, the short answer is yes. And here's why. We do not know how long the antibodies that you get from natural COVID infection are going to last. And so we do recommend that people who previously were infected with COVID get the vaccine. In terms of the timing of getting that vaccine, we do recommend that you wait until after your 10-day isolation period. So 10 days after the initial infection where you're advised to isolate before you get the vaccine, but you can wait up to 90 days after your infection to get vaccinated. But in short, yes, people who've been infected with COVID in the past should get vaccinated.
Great. Thank you. And so more and more people are determining that they will get the vaccine as they see more people taking it. How will they know when it's their turn to get the vaccine, and where do they go to get it? And I will throw that. Dr. Marcosi, please, let me ask you to answer that one.
Thanks very much. We are following the state of Maryland's plan, which is designed to be as fair and as possible, and to assure that there is enough vaccine for us all as more of it is received. In December, we started giving the vaccine to frontline healthcare workers. This effort remains ongoing. Starting today, as I discussed, the University of Maryland Medical System was giving vaccines to people in phase 1B. This includes people who are over 75 years of age, K through 12 teachers, and childcare workers. Everyone must schedule an appointment in order to get the vaccine at one of our hospitals. Right now, we are not able to take walk-ins. The next group is phase 1C. This will include people who are older than 65, public safety and healthcare workers who have not yet gotten the vaccine, and to other essential workers in critical industries, such as agriculture, manufacturing, or transportation. After that, we will offer the vaccine to people ages 16 to 64 who are at higher risk of severe COVID-19 because of other health issues or chronic illnesses. Other people who were not included in previous groups, but who are considered high risk, will also get the vaccine in this category. We will move through these phases as safely and as quickly as possible over the next few weeks and months. This plan may also change as more vaccines become available. We will continue to give updates to Marylanders as more vaccine is received. If you need to have more information, please visit our website, umms.org/vaccine.
Dr. Marcosi, thank you. I've got a couple more questions for you. And one has to do with something we're hearing from a lot of families, and that is, can pregnant women get the vaccine? Dr. Marcosi.
Yes, right now, there are not any contraindications to pregnant women receiving the vaccines. There are continued ongoing studies with regard to the effects of pregnant women receiving the vaccine and any potential lactation issues, and those studies are currently ongoing. But the American College of Obstetricians has come out with a policy paper that presently there are no contraindications to pregnant women receiving the vaccine.
Okay, all right. And one other question. So this means that it will be some time before a number of people in general will get the vaccine. What advice do we have for them to protect themselves? Dr. Marcosi.
Yeah, this is an important question. Thanks so much for this one, because COVID-19 remains a continued threat. And it is especially important that we all continue to practice physical distancing, wearing masks, and avoiding large gatherings. We know that this is hard right now, and it can be a little confusing when we also talk about how important it is to stay socially connected to each other. Staying connected is important, but we can stay connected over the phone or through texting, video chat, or emails. We can keep supporting each other from a physical distance so we don't risk the transmission of this virus to those of us who are vulnerable. It is also notable that even after getting the vaccine, it will be important for everyone who gets it to continue to wear masks and practice social distancing and avoiding social gatherings. We don't have any data yet around whether or not you can still transmit COVID-19 after being vaccinated. So that's still an important factor moving forward.
Very good. One other question for you, Dr. Garrett Ray. People are asking this question: why should I get this vaccine now? Dr. Garrett Ray.
Yeah, so I cannot stress this enough, and I will use the term that my colleague, Dr. Michelle Gordine says, bottom line, okay? Bottom line, this is the most important tool that we have in front of us right now to protect us and our community and to fight this pandemic. So it is important for all of us, and I encourage every single one of us to get this vaccine at this time. Dr. Wright had mentioned earlier, within our state, we have a large number of our Black and Brown and Latina community, and we all need to be protected in this. And this is a fight for all of us together. We are seeing that COVID is disproportionately impacting our communities in terms of hospitalization and death, and people are losing family, friends, loved ones. I have seen it in my own family and friends. A couple of weeks ago, we had lost a friend from COVID. So this is impacting all of us equally when you think about how it's affecting generations and families. So for our communities, our Black and Brown, our Latina community who carry so much of this COVID burden, 3 times more likely to die, it is so important, especially important that we are there and getting that vaccine. I cannot stress it enough.
Excellent, excellent. Speaking of bottom line, Dr. Gordine, the question that people are asking right now has to do with what does this vaccine cost, especially when we think about the health inequities and economic inequities in our society. Dr. Gordine.
A short and simple answer: the COVID vaccines are going to be made available to all Americans at no cost. So no cost at all, no need to worry about that as a barrier to getting the vaccine.
Excellent, excellent. The question now, Dr. Wright, that I want to address to you has to do with what Dr. King said about a message of hope. How does this vaccine offer hope to our community, Dr. Wright?
Yes, thank you, Dr. Hrabowski. And before I speak about hope, I would be remiss on this day if I didn't mention this quote. In 1966, well before terms like health disparities were part of our regular lexicon, Dr. King, in addressing the Medical Committee for Human Rights, said, "Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane." I reference that because we have a tremendous opportunity here. Everything that we've been talking about for the last 40 minutes or so represents tremendous opportunity to level the playing field for communities of color. Dr. King also said that we must accept finite disappointment, but never lose infinite hope. And in getting the COVID-19 vaccine, this is the most important way that we can work together to end the pandemic. And the sooner we get the vaccine, simply stated by our colleagues here, the sooner we can all attempt to return to our lives and realize Dr. King's vision of infinite hope.
Excellent, just excellent. Thank you for giving us that hope, Dr. Wright. You, in some ways, sounded like a man of religion, also of faith, and we appreciate that. Let me suggest that we now talk for a moment about, for each of the panelists, the question of why you decided to get the vaccine. Would be very helpful if we could do that. Let me suggest that we start with Dr. Barreto and come across to Dr. Marazi and Dr. Cynthia. You've already talked about it, Dr. Wright, Dr. Gordine, and Dr. Garrett Ray, please.
Well, I think all of us have positions within our family where we want to protect. We also have positions of leadership. In the beginning with the first surge, there was an honest concern. Everyone was afraid of contracting the disease. As time has gone on, even a greater fear of being a person who brought it into the hospital somehow, not knowing this asymptomatic state really caused so much doubt in your ability to even interact with other people and try and even come to work. So I did it for my family. I did it as a result of the position that I am, a position of leadership within the hospital as well as within the community. So I was proud, honored, and so extremely hopeful that once I received that vaccine to be able to contribute to this fight.
Marazi, Dr. Marcosi.
Yeah, thank you. So I was tired of this virus. I am tired of this virus, and I wanted to fight back. And this was my opportunity to answer, and to when the bell rang, to stand up and get into the ring. So I wanted to make sure that I took this because I've lost neighbors and friends to COVID-19, and I wanted to give it back to it. And this was my opportunity to rest easier at the end of the day, to know that I was going to be part of the solution and fight back. And finally, I'll just say this: I'm tired of not seeing my family members and not going to birthday parties or religious events. And so this was my opportunity to say, I'm going to get back to some degree of normal because I look forward to hugging my parents again. Thanks for the opportunity.
Dr. Wright.
Yes, I think the answer for me rests on several levels. Certainly personal. My family has been impacted by the pandemic, and I haven't been able to visit my mom in a year. So this is just very real at a very personal level. But also from a leadership perspective, to echo what Dr. Barreto has said, our health system, and particularly here in Prince George's County, where the disproportionate impact on communities of color has been felt dramatically. And with so many of our employees who live in the community, it is an obligation for us as leaders within our health system to demonstrate the importance of participating, to be at the table, to just echo what you said at the outset. It is really an important obligation for all of us to really model for our teams and the folks who we interact with at home, at church, where we hopefully will be able to return to play as well, to really get out front on this. So again, I respect the fact that this decision making is very personal, but I also believe that this is an unprecedented public health opportunity that we have to knock down this pandemic and to participate up front.
Excellent. Thank you, Dr. Gordine.
I felt an obligation to be an informed consumer, not just for me, but for my family members. My mom was calling me, who's 80 years old, saying, should I get this? Church members call, should I get this? Other family I haven't heard from in a month of Sundays called, should I get this? And I wanted to be able to project the assurance that the answer was yes. And so after doing my homework and understanding the science, I absolutely trust it. And I absolutely think it is vital to get it. And I absolutely believe that I have a role as a role model to demonstrate that, yes, I got it. And yes, I'm fine. The other reason is quite personal. Obviously, in addition to wanting to protect myself and wanting to protect my family, this afternoon, I'm attending the virtual memorial service of my great aunt who just died from COVID. I don't want to have to do that again. You know, to echo my colleague Marco, we're sick of this. You know, we are over COVID. And quite frankly, the only way to really get over COVID, the only hope that we have, bringing it back to the theme of this town hall, the only hope we have is this vaccine. And folks, you know, I'd much rather take my chances with this vaccine than to take my chances with the COVID infection.
Thank you very much, Dr. Garrett Ray.
I just want to echo what everyone else has said, my colleagues. They're personal, but they're also things that we need to do as leaders within our community, as well as within our organization. We took an oath. We all decided to go into healthcare because we care and we wanted to make a difference. And so today we're talking about finding hope. Well, we found hope. We found a solution that's out there that can help to protect us. That's the reason why I made sure to get my vaccine. I reviewed, I read the science, just like all of us. People look towards us. I'm a family doc, so people look towards us for what do you know about this? Bring the knowledge to us, but then also be the example. And so I wanted to make sure that I see generations to come. I have a daughter, but I want to see my grandkids, God willing. You know, I want to see great grandkids, but I also want to be able to give hugs to my family and friends and not see them at funerals through Zoom, but I want to see them in person and give hugs and be able to celebrate life. So that's why I took the vaccine and believe in the science behind it.
You all inspire us a great deal. You're physicians, and even more important, you're human beings, and you can relate to what people are talking about. We've had two questions from the audience that we want to address before we leave. The first is for you, Dr. Marcosi. Will the vaccine alter my DNA?
So the bottom line up front, absolutely not. There is no DNA alteration at all with this vaccine. It is only mRNA, which degrades probably within 2 to 3 days. There's nothing at all that would alter anyone's DNA associated with this vaccine.
Very good. And the last question, Dr. Suntha, I'm going to give to you, and then you can go ahead and give your closing remarks if you would. The question is this: what is the availability of the second doses, number one? And number two, people are frustrated about not knowing how to go about scheduling for the vaccine or to get information on it. So if you can talk a bit more about information on getting the vaccine. And first, though, the question of, is there a problem or is there a challenge with the second dose?
So sure, we can answer. The conversation about the second dose is, I'm sure, in part generated by some of the statements that we've heard in the last week coming out of Washington. And part of the approach of have we kept in reserve doses for those who got a first dose so that we can assure the second dose is, I think, a bit of confusion that was inadvertently created. From the very beginning, the planning associated with vaccine distribution considered the amount of doses that were available as we as a nation started vaccination, and then also considered the rate of production of the manufacturers, both Pfizer and Moderna, and their vaccine distribution. So when you heard over the last week this conversation of releasing the reserves, what that tells us is that the modeling for distribution of vaccine gives us comfort that those who got a first dose of the vaccine, that we have vaccine for the second dose based on the rate of production. So we have comfort in releasing some of those reserves. The idea of releasing the reserves is also driven by our desire to, quite honestly, try and vaccinate more of our community faster. And so you heard Dr. Marcosi describe our approach within the University of Maryland medical system is in complete alignment with the mandates and expectation that our state officials are giving us as a health system and the hospital industry overall. Our state has identified the priorities And the priorities are driven by the risk associated with our community members and the risk of both infection and the risk of potentially having severe impact by the disease and even death. And so, as he described, as we go to 1B, we, our health system, as of this weekend, have started to communicate directly with our patients who are in our health system, in any of our practices, who are 75 years and older. And we are now allowing that population to schedule within our health system. As of this morning, they can go, they will get a email communication. There's a way to connect to a phone number that will allow us to now actively schedule that group of high-risk members of our community. We've also heard the governor say that as of next week, they're going to expand that out to now include people who are 65 or older. So as the state expands the criteria, we will expand our access as a part of the state's solution. So across the state, we have health systems, we have health counties, the county health officers, and we are standing up vaccination centers across the state to go beyond just our health systems as a solution. So it is, I think, a challenge that we are all facing to pace the rate of standing up vaccination access to be consistent with the demand our communities have. And this speaks to a conversation, Dr. Hrabowski, you and I had now over a week ago, which is one of the reasons we're having this conversation this morning, is that we have sort of a spectrum of reality within our communities. One part of that spectrum is the concern and the hesitancy that we are trying to address with science and with information, especially in our Black and Brown communities and people who have been disproportionately, historically disadvantaged, and also have disproportionate risk associated with this disease. On the other end of that spectrum is the tremendous demand that many other parts of our community have for wanting immediate access to this vaccine. And so we, as a health system, as part of the social safety net that our health system and other health systems in the state serve, have the responsibility of striking this balance appropriately. And so this education, this conversation today, is to bring our communities along so that we can serve the needs of vaccinating our highest risk members of our community at the right point in an ethical, through an ethical process. So we are indeed pleased and incredibly thankful to you for serving in this role as a moderator today, Dr. Hrabowski. The gravitas you bring to these conversations can't be overstated. And so we are incredibly grateful. We want to make sure also, I want to make sure any of our panelists, if there's anything that you would want to add to what I said about our process, please, I know we have many of our counties represented by leaders, please, I'll give you that opportunity now, and then we'll wrap it up.
You are so good, quite frankly, and thorough. I'm looking to see if anybody wants to add anything. These are physicians, so they get to the point. They're not like the rest of us. They get to the point, very much so. Anyone want to say anything before I conclude? I want to thank. Go ahead, Dr. Wright. Did you have something?
I just want to say, just to dovetail on what Dr. Suntha said about working with our colleagues in the county health departments, certainly here in Prince George's County and across the whole system in the whole state. As I mentioned, fully 68% of our employees are of color and predominantly live in the county. So we are you and you are us. And to be able to collaborate and work together, we're pulling oars to the same goal, which is to get the population vaccinated. So that's my only comment, that I really appreciate the collegiality of our partners in the health department, and we are all striving for the same goal.
Excellent. Excellent. Thank you. Anyone else? Any comments before I close? Let me, on behalf of the University of Maryland medical system and on behalf of UMBC, thank all of you panelists and the people in the audience. Just a couple of points. We are blessed to have, I want to give a shout out to the University System of Maryland, because we're producing these healthcare workers of all types on all levels for our state, beyond and beyond. And it's a big deal. We love sending people down to the Maryland Medical School and in the University of Maryland Medical System, graduates from all of our campuses. And it's important for people in the state to know they come from all races, men and women. It's an impressive statement. And the final statement, to bring a little humor, is that I'm the only one on this call that is not a physician. I'm a mathematician. And I think they invited me. So anybody calling me asking for advice, I'm going to get you to your physician. It's important to know what you know and what you don't know. But this is what I would say to all of you. I was blessed to be here at this university helping to produce some of these doctors and scientists, from the health commissioner in Baltimore City, who's our graduate, all the way to the Surgeon General, both Black. The Surgeon General had never seen a Black coming out of Mechanicsville, Maryland, had never seen a Black doctor before coming here. And so this is what we mean when we say keep hope alive. As a child growing up under Dr. King, I remember hearing him say, tomorrow can be better than today. He would not have believed, as none of us, that we'd be talking about a scientist, Dr. Corbett, creating the vaccine. And there's a message to families and to little girls that you can do all of this. You can be a doctor, a scientist, you can create the vaccine. That is what we have to hold on to, that this is for all of us in this country and beyond. And so I challenge us as a country and as a state, in the words of so many, but in the spirit of Dr. King, keep hope alive. Thank you.
Dr. Hrabowski, thank you so much for those inspirational words. To our panelists, I want to say thank you. Thank you for giving us your time, your energy, your passion around our fight against this pandemic. For our audience, I want to make sure that, as we said earlier, that we know that we were not able to answer all of the questions that came in through the chat room. We are committed to doing so, and so you will find later in this week on our website, umms.org/findinghope, the answers to questions that came in. In addition, please continue to check these websites, umms.org/vaccine, for the latest updates as the evolution of the distribution of vaccines continues in alignment with the mandates that come from the state. We will continue to update our access and our protocols as a health system. And importantly, we also are committed to ensuring that this information is available in Spanish. And so we have umms.org/COVID Espanol. We will have this information available in Spanish as well. We also want to make sure that if you have questions regarding COVID, you can call our nurse call line. It's a free call, 24 hours a day, 7 days a week at 1-888-713-0711. So again, Dr. Hrabowski, thank you so much. To our panelists, thank you. And Dr. Hrabowski, you said it best when you said, today we believe is a demonstration, a tangible example of Dr. King's legacy and the notion of keeping hope alive. Thank you.
Thank you very much. Thank you.